Healthcare in Sweden. Sweden is located in Northern Europe and is part of Scandinavia. The population is 10 million, with 2 million people under the age of 18. Over half of the landmass is covered in forests, and there are over 24,000 islands. The official language is Swedish. However, English is widespread, and most universities offer a curriculum in English. The government pays students an equivalent of 187 US dollars a month to attend high school. Sweden has a democratic parliament. This means there's no presidential elections, only parliamentary elections where public power proceeds from the people through elections every 4 years. Parliament introduces and passes laws, and the government enforces them. There hasn't been an official religion since 2000. However, most Swedes belong to the Church of Sweden, an offshoot of Lutheranism. Healthcare is free, along with other social programs administered by the government. Sweden is divided into 290 municipalities and 21 county councils under the central government. The role of the central government is to establish principles and guidelines for Sweden's healthcare. However, Sweden's healthcare is decentralized, and therefore each county council is responsible for their population's healthcare and regulated under the Health and Medical Service Act. Sweden has a few challenges to accessing healthcare. 1. Geography. People living in rural areas are less likely to seek out medical services compared to those living in towns or cities. 2. Socioeconomic status. Those less educated are less likely to seek out medical services compared to those with more education. And 3. Service expenses. For example, the elderly are not exempt from medical service fees. This discourages them from seeking health care and purchasing needed medications. Benefits for patients receiving care in Sweden include the following. Bulk of medical costs are paid from taxes from municipals and county councils. Bills that are not covered by this fund are to be paid by the patient. However, an extremely helpful benefit is that the patient has a cap on their medical expenses. Patients are to never pay more than 1,000 Swedish krona for medical attention in 1 year. This amount is equal to 108 US dollars. There are minimal wait times for specialists. The law states that patients are to be seen by a specialist within 90 days. And if surgery is necessary, it would need to take place within the 90 days to provide optimal outcomes. Patients are also to be seen within 7 days for a primary care visit. Mental health is recognized as being crucial to quality of life and is treated promptly. Lastly, there's womb-to-tomb care. Terminally ill patients are treated physically, mentally, and financially, alleviating patient and family's burden associated with such care. Terminally ill patients receive a percentage of their wages paid by the hospital for 14 days. After that, the employer is to pay the patient their wages until the patient passes. Sweden recognizes that patients are going through changes and are getting last-minute things in place before death, and do not want to add financial stress to patient or the family. Quality care is providing the best care possible for patients of all ages and meeting all of their basic needs. Examples of quality care in Sweden include 1. Patients that enter nursing homes for care are allowed to have their healthy and independent significant others live with them. This keeps families together and alleviates stress on patient and family. Additionally, constant revisions and additions to the plan for the elderly are made every day. 2. Education and frequent screenings for all types of cancers and disease processes. Education on the importance of health promotes a healthy lifestyle, and less medical attention is needed for the citizens. Moreover, implementation of national guidelines on smoking, alcohol use, physical activity, and diet are used to promote health. Lastly, there's a focus on patient-centered care, including emphasis on patients' involvement in their treatment and recovery. For example, upon admission, immediate disclosure of condition and recovery times. And then, on discharge, patients are given a survey to rank their hospital stay and are given the opportunity to state ways to improve. Becoming a nurse in Sweden is similar to the United States. Applicants are required to complete high school and be proficient in Swedish and English. A 3-year degree is necessary to be deemed competent in biology, anatomy, and nursing practice. Nurses are required throughout the schooling to focus on nursing skills, and a comprehensive examination following training is required. To become a physician in Sweden, completion of high school and proficiency in Swedish, English, math, and the sciences is required. Without all of these, acceptance into the program is denied. Upon admission to medical school, students will study intensely for 5.5 years, including clinical hours working alongside another provider. A comprehensive examination following the training is required to become an MD. Receiving healthcare in a foreign country can be overwhelming and scary. Language barriers, difference in hospital settings, and financial aspects can delay immigrants or visitors to the country from receiving the care they need. Sweden tries to provide the best care they can to immigrants, which they do this in a few different ways. The first is receiving prompt care at a cost depending on where you are from. For example, if you're visiting but are from the United States, it's possible that you may pay a reduced cost or even the same as someone living in the country. Those seeking asylum, which is leaving your home country and seeking a new country to live in, also known as immigrants, are entitled to free medical and dental care if emergent. Those who have children under 18 are provided free health care on the same terms as other children living in Sweden. If treatment is needed but not emergent, an immigrant adult can pay a discounted price of 50 Swedish krona, or $5.41, to receive treatment. Immigrants seeking care need to inform the clinic of their name, phone number, and date of birth. They also need to show their LMA card, which is a temporary identification while waiting to become a citizen of Sweden. Those who do not have this card are limited for regular health visits. Once they sign up, they will be eligible for a free health checkup and are then given the opportunity to pay the low price for other office visits. Everyone is entitled to an interpreter. Sweden is aware of the fact that many people visit and live there that are not native to the country. They provide competent care by providing an interpreter to anyone in need for no charge, and they find it medically necessary for those receiving care to understand their diagnosis and treatment. Beginning of life policies. Antenatal care is a free health service for pregnant women in Sweden. The program is mainly led by midwives who visit the mother routinely before birth and one time after birth. The visits include medical checks, psychosocial evaluations, and health information. Additionally, it includes an ultrasound screening with an anatomical assessment, and for a woman's first pregnancy, a childbirth preparation class. Sweden has an exceptional paternal leave policy for both mothers and fathers. Interestingly, Sweden was the first country in the world to offer paternity leave. Sweden's family leave policy offers a total of 480 days of leave, and each parent has a right to 240 days. However, days can be transferred between parents, or if a single parent, they are entitled to all 480 days. The paid leave is financially covered by the government. Lastly, parental leave is a law protected, and the employers are not to prevent promotions, reallocate, or terminate those employed. End-of-life policies in Sweden. Euthanasia and physician-assisted suicide are both illegal. However, Sweden has recently taken steps to enhance palliative care for patients. For example, palliative care for patients has recently been enhanced through training to providers. Informed conversations with patients and families regarding families' palliative care are required. And county councils are required to provide emotional and practical support for next of kin of dying patients, including post-bereavement meetings for family members. Sweden's healthcare is publicly financed and predominantly financed by income taxes. Under the Health and Medical Services Act, all legal residents are covered. Additionally, emergency coverage is guaranteed for all patients from the European Union and to 9 other countries that Sweden has a bilateral agreement with. Likewise, asylum-seeking immigrants and undocumented children also have access to health care. Sweden also offers private health insurance to residents. Private insurance is primarily purchased to gain quick access to a specialty physician or to avoid waiting times for elective surgeries. County councils are financially responsible to cover people's hospitals and primary care. County councils establish provider fees and therefore vary throughout the country. Municipalities are responsible for people's social care. This includes child care, school, health services, care for the elderly, disabled, and psychiatric patients. A few identified problems with Sweden's healthcare system include: Sweden's elderly population is one of the largest in Europe. This puts a pressure on the healthcare system. Additionally, county councils are often moving elderly patients out of hospital beds too soon. This is because of the expensive hospital costs, and they hand over the financial responsibility to municipalities covering long-term rehab centers. Also, certain prescription drugs are not considered under the National Drug Benefits Scheme and have to be paid in full price. Frequency of long wait times to receive medical attention, especially patients with greater illnesses requiring advanced care. And lastly, lack of nurses and other healthcare providers to care for the growing elderly population, and increasing number of patients with chronic diseases and multiple diagnoses requiring integrated care. Healthcare reforms in Sweden. To reduce wait times, Sweden introduced the zero delay policy. The policy guarantees that a patient will see a general practitioner in 7 days, a specialist in 90 days, and wait no longer than 90 days after being diagnosed to receive treatment. If the allocated timeframes are met for at least 70% of the patients, county councils are eligible for a financial grant. Next, to encourage continuity of care through coordination and collaboration between healthcare providers, grants are offered to providers. Additionally, the government launched a national initiative for patients suffering from chronic diseases. The 4-year plan will focus on patient-centered care, evidence-based care, and prevention and early detection of disease. Lastly, to enforce patients' rights and their right to integrity, influence, and shared decision-making, a new law was established. The law declares that providers have a responsibility to convey information to their patients have a right to a second opinion, and patients have a choice of any outpatient specialist in the country.